Mary. My name's Michelle. I am one of the nurses here at the doctor's office. I would like to sit down with you and teach you about preeclampsia and how that affects your baby. I'm also going to talk about some things that you need to do to take care of yourself at home. I would also like to instruct you on how to do your 24-hour urine at home.
Okay, that would be nice. I really have no idea what this means. It all seems quite overwhelming.
First, let's talk about the symptoms you are having and what we see here in the office that tells us you have developed a disease that can occur in pregnancy called preeclampsia. This diagnosis affects you and your baby girl. Preeclampsia can be dangerous. The only cure is delivery of your baby. However, you are 35 weeks and your symptoms are not severe enough to deliver your baby early. This condition can cause high blood pressure. At end stages of this disease, you can have seizures, your liver may not function correctly. It can also cause problems with babies such as infant death. So Mary, can you tell me what you know about preeclampsia?
Preeclampsia is a condition I've developed due to my pregnancy. The only way for it to go away is for my baby to be born, but it's still too early and my symptoms are not bad enough for the baby to be born. It causes me to have high blood pressure, and if it gets bad enough, it can cause liver damage, seizures, or my baby to die.
That's right. So some of the symptoms you need to look for at home are severe headache that is not relieved with Tylenol, changes in your vision like blurry vision, seeing spots or light sensitivity, nausea and vomiting, swelling of your face and hands or legs. So what symptoms do you need to look for at home?
Bad headache that medicine doesn't take care of. If I have visual changes like blurry vision, nausea, or if I'm throwing up, bad swelling of my face, hands, or legs.
Okay, that's good. Things that we are looking for when you come into the office is if you are spilling proteins in your urine, sudden weight gain, high blood pressures, decreased platelets in your blood work, and what we call hyperreflexia, which is when your reflexes become too brisk. These things we will keep a close eye on to let us know if it's time to deliver. Do you understand the things I explained to you and about the things we look for in the office? Can you explain to your mom in your own words what we look for when you see her next?
I think so. It's a lot of information, but from what I understand, you're looking for protein in my pee, see if I gain a lot of weight, if my blood pressure is too high. Also, you're going to take my blood to see if this is making my labs abnormal, checking my reflexes with the hammer to see if they're too brisk. If any of these things get too bad, then they're going to deliver my baby early.
Great. I think you're doing a great job so far of understanding what is going on with you and your baby.
Thanks. I feel like things are starting to become a little bit clearer.
I'm glad. Now we need to talk about what you need to do at home to take care of you and your baby. Are you ready to move on?
Yes, I am.
Let's start with how to do a 24-hour urine at home. The reason we call this test a 24-hour urine is because you'll be collecting your urine in a jug, this jug right here, for the next 24 hours. We are looking to see how much protein is in your urine. We're going to give you a big plastic jug to store your urine in and a urine collection hat for your toilet at home. Once you start the 24-hour urine and you put it in the jug, it needs to be stored in a cold place, either on ice or in a refrigerator. So what supplies do you need for a 24-hour urine and where do you need to store it?
Let's see. I need the big jug for my pee and a pee hat for my toilet to pee in. And I need to keep it cold, so like keep it in the fridge.
That's right. Now let's talk about the rules for collecting the urine. When you pee for the first time, you will then start your urine collection time and mark it down on your worksheet right here. So if you start at 3 o'clock p.m. today with your 24-hour urine, you will end it at 3 o'clock p.m. tomorrow. However, you will dump your first void into the toilet and not into the jug. After you dump that first void into the toilet, you will then start storing your urine in the jug. Remember, it is important to collect all urine from start to finish and keep it cold. At the end of your 24-hour urine, you will avoid one last time right before end time and put it in the jug. Okay, so now tell me how you will do your 24-hour urine in your own words.
When I pee the first time, that will be the start time of my collection. But I don't keep the first pee, I dump it in the toilet. I will record the start time on my sheet and then it will be exactly 24 hours later. I collect everything, I keep it cold, I pee again right before the end time and put it in the jug.
You're doing a great job, Mary. Okay, so once your 24-hour urine collection is done, then you will bring it straight into the office as soon as possible. Do you understand that it has to be turned in immediately?